For months, 7 investigator Ross Jones has been digging into the conditions at the Harbor Oaks Hospital that sent some to the emergency room.
It was dangerous to come to work.
There are more claims tonight that patients at a youth treatment facility are forced to fight by staff members.
An unsafe environment full of violence. We spoke with dozens of people about what happened. Many of them didn't want to go on camera.
We uncovered more than 80 violations, including the most severe kind, immediate jeopardy. That's when a condition is so bad a patient could be harmed at any moment. We also reported on a patient's suicide and 2 wrongful death lawsuits.
A North Little Rock Child Care Center under a DHS investigation once again for possible child maltreatment.
Its West Memphis facility also still under probation after another boy was left unattended and died in a hot car earlier this year.
Attorney Joey McCutcheon has filed a lawsuit on behalf of a 10-year-old boy's family after they say he was sodomized by a mentally ill 14-year-old inside of a van.
When a company doesn't follow the safety rules of supervising and training their employees, things like this happen, and it can happen to any of our children.
Up until now, Acadia has managed to conceal widespread patient deaths, beatings, and sexual assaults. We found that Acadia's problems are widespread and impact patients across the country. We specifically identified more than 75 Acadia facilities in 24 states where indications of deficient patient care have emerged. In Pennsylvania alone, we found that government inspectors uncovered 555 violations at 36 Acadia facilities since 2015. 97% of these facilities had deficiencies related to staffing or patient care.
The whistleblowers paint a startling picture of what's going on inside the mental health facility and whether hospital management used smoke and mirrors to fool hospital watchdogs.
DHS confirmed they are investigating.
We completed a massive forensic investigation involving thousands of pages of documents that centered on a simple question. Why are patients being neglected, abused, and even dying inside Acadia facilities across the country?
Hospital management routinely puts profits over safety.
Why do you think they kept turning you down when you were asking for more staff?
Corporate profits.
Did you feel like patients' safety was a priority?
I think money was a priority.
We found that cutting staffing costs to the bone is the secret recipe used by management to inflate short-term profits.
One way Harbor Oaks has avoided scrutiny for understaffing, she says, is by increasing staff levels when hospital watchdogs are on site. The Joint Commission, also known as JACO, accredits hospitals like Harbor Oaks.
And then as soon as JACO would leave, they would give the staff low work time and send them home.
Harbor Oaks cut staffing by nearly half right after it passed its JACO survey.
Documents reveal that Acadia has degraded patient care by limiting the availability of medical professionals or hiring unqualified or improperly trained staff. Non-medical personnel, such as the secretary, allegedly have made treatment decisions. Government inspectors have even found instances where patients have died under the supervision of unqualified staff. Overtaxed Acadia medical providers resort to using chemical restraints on patients, where they deliberately over-medicate individuals for the convenience of Acadia staff.
They would rather have more money than to make sure that their staff was safe. I shouldn't have to be afraid to go to work every day. I believe that a lot of the things that happened there could have been prevented by having a proper amount of staff.
Underspending on staffing temporarily juices profits because it's the company's largest expense, but it leads to chaos, violence, and deficient care. Jacobs first used this slash and burn model at Psychiatric Solutions. Investors sued for fraud, alleging Jacobs had downplayed the alarming incidents of abuse, neglect, and even death at company facilities. Jacobs founded Acadia in order to replicate PSI's roll-up strategy. Acadia has borrowed over $3.2 billion to acquire behavioral health facilities, then wires out profits by cutting staffing expenditures while increasing beds. As undisclosed problems have mounted, Acadia's 4 top officers dumped over $40 million worth of stock last year, with Jacobs divesting half of his stake and later purchasing a portion of the Nashville Predators professional hockey team. Because Acadia's costs have already been cut to the bone, the company has exhausted its primary means of driving profits from existing facilities. We believe staffing expenses are likely to increase significantly as scrutiny from the public and regulators intensifies, because Acadia will face increased pressure to improve patient care. But Acadia has over $3.2 billion in debt it needs to service, which leaves the company little room to weather increased expenses or reduced revenues. We therefore see significant downside potential in Acadia shares.
I think being a good leader means that you set an example, taking care of our patients.